Hey guys, welcome back to my channel. I know it's been a couple months since I've filmed a video for you. I am going to have an entire life update video for you and some more videos coming. So recently I've been looking into getting my nose fixed, and rhinoplasty, like the complete surgery, is completely out of the question. I just am not willing to spend $5,000 to $10,000 just to fix my nose. And after being introduced to Dr. Charles Runels, who is with me today, he informed me that there are other ways of fixing a nose, and one of the ways is actually doing non-surgical rhinoplasty, which is also considered to be called a Juvederm nose job. So Dr. Runels, would you mind telling me a little bit about that?
Yeah, sure. So the fun thing about Juvéderm is you can sculpt with it just like you did as a kid with Play-Doh or something. And it causes new collagen to grow, and you can't make anything go away with the filler. Obviously, that's where there's always a place for surgery. And in some things you just can't make better without surgery. But if there's a little bump, you can make it look smoother by putting material on either side of the bump, and that smooths it out. And so what you have is I'm sure to you looks huge, but it's actually not that big. It's not so much that we can't make it much better by molding around it with some Juvederm. So that's what I have in mind. Should be fun.
Okay, so would you recommend Juvederm to a regular, like, full rhinoplasty to people? Or?
It depends. Let's suppose that someone has their nose it's broken and it's crooked, and it's a really large defect. Well, in that case, you might need to have surgery. Or if someone had, say, this part where the nares needs to be reshaped or made smaller, that's going to be more surgery. But if it's just one discrete bump and the nose is relatively straight, you can put material on either side of that bump and make it less noticeable. And it takes just a small amount. We'll actually have leftovers to look around to see. Your face obviously is attractive, but there's some things that we might do in other parts with your cheeks and around your mouth just to touch things up. We call it tuning it up. So that's what I have in mind.
What exactly is Juvederm? Is it like a gel? Is it just, I mean, what is it classified as?
It's a hyaluronic acid. Juvederm is classified as one of the fillers, and it's really a form of collagen. When you put it in the face, it works like collagen. If you remember in your high school science class, when you look at a picture of the skin, all the pink stuff that the blood flow and the hairs were growing out of and the nerves were running through, that's collagen. And this is what Juvederm is. It's also similar to the fluid in the knee. And when you inject it, it doesn't really completely go away. It fades some, but it's a natural type of product similar to collagen.
So does swelling around the nose or eye area ever occur after Juvederm? Or?
Anytime, just with a needle, if I weren't even injecting anything, anytime you do a procedure that involves a needle, there can always be swelling and bruising. If you're careful with it and you're experienced, you can make it more minimal, sometimes to the point to where it's not even noticeable. But usually you should allow at least a couple of days for possible swelling or bruising.
Okay. Can you normally cover that up with makeup? Like,
Usually
say if you have to go to work, so there's no, like, rest time, really?
It's not like surgery where you need to hide for a couple of weeks. You might, in some cases, have bruising you cannot hide with makeup, but usually in the right hands, you won't have anything that you have to go hide for.
So how exactly do you shape the nose after you, is it injecting the Juvederm?
So we'll put some numbing cream on the area where we intend to work, there and maybe a couple of other places I'm looking at. And then we'll just go, it's a tiny needle. After the numbing cream is soaked in, we'll put in just small, literally drops. The face is so particular that usually what goes wrong when people have injections is the doctor over-injects and creates weird shapes by overcorrecting. The art with Juvederm, or anything to do with the face really, is to see what's beautiful about someone, and we're all made beautiful, but to see what could be made better, but still keep that person with their natural contours, but just enhance what's attractive and make less noticeable what's not as attractive. So that's the art to it, and we'll I think you'll find it's fun because it's immediate. As soon as you're done, you can see it.
Can you explain to me kind of like what the pros and the cons are of using Juvéderm? Like I know it's not permanent.
Versus something else?
Yeah.
Well, versus surgery, it's not permanent. And it's obviously much cheaper. Most people charge around $600 instead of 10, 20 grand. But it's you can go back to work that day if you want. And in some ways, it's better because you can make minimal changes and you can make it exact. Or sometimes with surgery, it can be more, it's harder to be more as subtle. But there's always a place for surgery. There's some things you cannot do with an injection, like if it's crooked or if it's too changing or making the nose more narrow where the nares are. There are things you just need to have surgery for. Like if someone has a lot of extra tissue under the chin, you can't correct that by putting in fillers. But on the other hand, if someone has loss of volume and their face is collapsed, adding volume can restore a youthful shape. So there are some things you can do with fillers that you cannot do with surgery. Juvederm Ultra Plus is one of my favorites for sculpting the face. People ask me a lot, well, why not use Voluma? Voluma is used in the cheeks a lot, but it's harder. It's thicker, so it doesn't work as well in the mouth. But when I actually trained with Juvederm, it was not even approved in the U.S. yet. I was trained in Toronto when the Canadians had it before we had it. And we were using it the way they're using Voluma now. I think it's less irritating than Restylane, and the way the syringe is made, I can be more exact with it. Restylane a great product, but it comes in a thicker, shorter syringe. I can't be as precise in the way I inject it.
Are there any injections that are permanent, or is it just all?
There are some permanent fillers, but the thing about permanent is permanent good can also be permanent bad.
Yeah.
And there's a little enzyme you can inject to actually dissolve Juvederm if it's too much or it's in the wrong place. So far, I've never had to dissolve something that I put, but I have had to dissolve some things that other doctors have put, where they put too much under the eye, especially, which can look lumpy, or too much in the mouth, where they came out looking like a duck.
Oh,
and so all sorts of things can go wrong, and permanent fillers are very, very scary, I think.
Once we do this procedure, and you shape my nose and everything, what happens if I get hit in the face again? Is that going to move my nose?
Well, if you get bumped, it won't make that much difference if it's just like a normal sort of activity, or dancing, or just hugging your mother and you bump your nose, it won't matter. But if you break your nose, obviously, or some major trauma, then it would be as it normally would be.
So it's pretty strong. It's as strong as the cartilage, or is...
It's going to be as strong as, say, not a bone or a stiff cartilage, but it'll be like the tissue of your cheek. Your cheek is round because there's enough supporting structure under there to keep that shape.
Okay.
And so it'll be enough to shape that space.
Is it going to feel like squishy or anything, or is it just...
It's going to feel like a nose. And I don't know any better, because we sort of know what that feels like.
Yeah.
Right? It's got a certain amount of give, amount of firmness to it, but it's covered with something that's soft on top. And with your eyes closed, you could touch something and say, well, that's a nose, right?
Okay.
And then when I'm done, you can still close your eyes and it'll feel like a nose, I promise.
All right. You also invented and trademarked the Vampire Facelift. What is that?
Okay, so the facial is something where you take needles that go 80,000 times, 80,000 little puncture wounds per minute. It's like a mechanical stimulant of collagen. That's what Kim Kardashian did on her television show that she made famous. The Vampire Facelift is, instead of making and after you make the needle marks, you put blood on top of it that comes from your body. You get the growth factors from it.
Oh, that's what that was.
That's why she looked red.
Oh.
It wasn't from the needle marks. Don't bleed that much. It's painting the blood on afterwards. And it's the same sort of process that the NFL has used for 15 years, getting growth factors from the blood to regrow the joint tissue. Instead of that, it's being applied to the skin to rejuvenate the skin. And the needle marks help it absorb and help stimulate growth too. That's the facial, it's topical. The facelift is injecting it under the skin along with some Juvederm to sculpt the shape and affect the color texture. So the facial is more for texture and color. The facelift is about shaping with Juvéderm and getting color, texture, and some shape from the growth factors from the blood. So the vampire word is to imply the youthful. Vampires are youthful because of blood. And they're sexy, so it's youthful and sexy from blood is what that means. And the facial is topical. The facelift is under the skin to create a new shape.
Okay, so it's the same thing with, I think it was the vampire breast lift too?
With the breast lift, you're injecting in the fatty tissue of the breast, and it causes it to become, the fat has lots of growth factor, lots of stem cells, and they just go crazy. The cleavage becomes more round.
Oh, wow. Okay, so basically you're saying you would take my own blood and make myself beautiful again, just using my own blood?
Beautifuler.
Beautifuler. I like that.
Yeah.
If you can, from start to finish, can you explain like the entire process to me? Like how long does it take? Like what you do to start off and the injection?
For the nose? So it's not a sterile procedure. You don't sterilize your body with betadine before you get a shot. You just clean it with a little alcohol and then you get a shot. Well, these are shots. They're just, instead of injecting penicillin, we're putting a collagen-like material. So we clean the face with a little alcohol, put a cream that has lidocaine that gets absorbed into the skin, and then I take pictures, which we've already done, try to figure out where to put the material. That's where there's a little bit of art becomes involved, how to look at the face and what makes it more attractive and more aesthetically pleasing, but still keeps it natural.
If you guys want to watch the entire procedure between me and Dr. Runels, then please keep watching and don't forget to subscribe to my channel. Bye guys!
But I do a lot of bloopers at the end of my video. Oh, bloopers are my favorite parts of it. Said that possibly Juvederm could be a good alternative for me to get a nose job. No. Also said that Juvederm would possibly a great... Alright, start over. Also founded the cosmetic...
Stop right here.
Yeah,
Just say,
stuttering.
what you can do is let me talk about that
Okay.
part. That's why you're stuttering.
Alright.
It's because I need to say that part. So you can say, Dr. Runels, who walked across the street and I just fell madly in love with. No, you can leave that part out. Dr. Runels, when he came across the street and I asked him the best thing to do with my nose, said he had some ideas. And so here we are. So tell me what you have in mind, Dr. Runels. Done. And then I'll explain it.
Lord, I'm still going to stutter that.
Just say, Dr. Reynolds says he might can do some magic with my nose, so what do you have in mind? And I'll talk about it. And I'll explain.
Okay.